Welcome everyone, I'm Ann Erkes. I'm going to be facilitating our discussion today. I've asked you guys all to come here because you're great experienced nurses on the floor and you guys would best understand the flow of our hospital. So today we are going to discuss hospital consumer assessment of healthcare providers and systems. That's a mouthful. Those are also known as HCAHPS scores. HCAHPS scores have been used for a while now to rate our hospital on patient satisfaction. But now there's a change in the government and they're going to use these HCAHPS scores to determine how we're going to be reimbursed and rated. So, and soon enough, private insurances will be following suit. So currently the HCAHPS have 8 metrics, and these 8 metrics are asked of the patients and their perception of our nursing communication, our doctor communication, our responsiveness of staff, pain management, communication of medications, discharge information, our hospital environment, and our overall rating of our hospital and their willingness to recommend it. So with this shift of rating on our facility, we need to, our goal today is to come up with a change in process possibly to help improve our HCAHPS score while meeting the needs of our patients. So what are some things you guys currently do on the floor that can be improved upon to help improve our patients' experience?
Well, seems like a lot of those are about communication. And one of the big times that we communicate is during report, and we never really include our patient in those discussions. So maybe, I've heard about it, and we get handout from cath lab at the bedside, and the patients like that, but we don't do it standardly. So maybe that's something that we could think about doing is report at the bedside.
I think that's a good idea. Just to make sure I understand, you're talking about any time we transfer a patient from a department to another department, we use a standard form, right?
Anytime there's a handoff of care.
A handoff of care. Okay, well, I think that's really good for our patients, because I know when we move our patients from PACU or even a direct admit, we give a report, but different departments request different things. So we definitely would have to come up with a way of standardizing it.
Well, if we make it standardized, we should probably figure out some sort of way to get all this information out to all of the staff. We know the feedback we get from nurses around the hospitals that they never know what we're doing or what to expect or what's going on. So we should probably then develop this process and then identify some sort of kickoff date so then everyone knows the expectation and everyone knows when this is going to be happening. The other thing that we probably need to do is prepare our patients for this. So the patients potentially could go from one day where handoff is out at the nurse's station and the next day, that evening potentially, or the next morning, it's right there at their bedside. So we need to make sure they know what to expect and prepare them as well so they can be engaged and tuned. And then also preparing them and helping them will allow them to say, I don't want you to give this report if my Aunt Sally is in the room or my children or whatever, because we haven't shared that information too.
So if we do this standardized report, what kind of tools do you think those nurses would need to improve their report process?
Well, I think one of the reasons we don't do it now is there's a level of intimidation of saying the wrong thing in front of the patient or not really knowing what to include in a report. Because I notice when I report, some nurses, they give me like detailed head to toe, tells me everything that I could ever imagine knowing about a patient, and I don't need to know all that information. And then there's other nurses, and they don't even tell me the basics of what's going on, and they don't really understand what they should be handing off to me. So maybe we should just create like a standardized report form as a tool so that everybody knows going in to be prepared to give this information on their patient.
Okay, so let's say we make a standardized report form. What do you guys think should be on that form?
Well, I think it should always start off with our basic patient identifiers.
Okay, let me write these down and
Okay.
say them.
All right. So like our patient name.
Okay.
And maybe what they like to be normally called.
Okay. So their preferred name?
Yeah, preferred name. And then why they're here, so they're admitting diagnosis.
Okay.
And then definitely the significant events, if there are any. Those are just the big three in my mind.
I like where this is going because I can already hear some of the pushback we're going to be getting from the nurses saying, well, this standardized card or this standardized report that everyone developed, that won't work in my area because I work in peds and that won't work for me. Yes, more specialized areas, and just saying something as significant events, that allows me as a peds nurse to identify, well, what are the significant events in this department? And as an OR nurse, what are the significant events in the OR, acute care, ICU, those types of things. The other things we want to include is probably the head-to-toe assessment.
Okay.
I don't know that we need all of the abnormals.
Yeah,
So
please. I just want to know what's abnormal. I don't need to know that, yes, like neuro's within normal limits.
Yeah, if something's, if the system's within defined limits, we probably don't
Just
need
leave it out.
to talk about it.
So emphasize only abnormal.
Only the
You know, if we don't
abnormals.
talk about it, then it's normal.
Right, and I can always look that up on the computer. I mean, you can always, we're trying to
Find
just,
that information.
yeah,
Yeah,
it's not as if
absolutely.
that resource isn't there.
Probably safety concerns.
Okay.
So safety concerns is the patient confused at all trying to get out of bed? Are they at fall risk? Do they have some skin integrity issues? Special needs. Again, and these can all be customized to the floor. So special needs might include the need of an interpreter. So if you know the physician is coming in, having a heads up that you're going to need an interpreter would be really important. Goals. The patient's goals as well as our nursing goals. What are the things that we need to get done today to move the patient towards discharge? And along with that, the plan of care.
Okay. Goals and plan of care.
Goals and plan of care. And I think that would be really important to discuss in front of the patient so then they know what to expect throughout the next shift.
That'll help with
Right.
that communication
Well,
thing.
and I like the
Absolutely.
goals too, because sometimes my goal as a nurse is different than what their goal is, and so they can be a part of it, which I think helps with some of your HCAPS
Right.
matrix. So I
Developing
think
those
that's
goals. Another really important thing, and I know we always get the notes on these, are core measures.
Yes.
So any core measure items or the core measure patients, so you have heads up that, yes, this patient is going to fall into that category, and these are the things we need to look for with these
Yeah.
patients. I know something else that comes up quite a bit is the IV assessment,
Mm-hmm.
and really doing a full top to bottom IV assessment. So starting at the bag, working down through the pump, making sure, checking all the rights, and then finally checking the IV site.
So a complete IV handoff.
Complete IV handoff.
Yeah, don't leave a mess for the next shift.
Absolutely, absolutely.
Well, and there's just a few other things that I think are important, because to me, when I think about this, I think of this handoff as occurring not just from department to department, but maybe from shift to shift. So this isn't just, it can be applied in multiple areas. So for me, I'd want to also include any incomplete tasks
Okay.
that I know we all try to get everything done, but in that way the patient knows that we're communicating that to the next provider and they're going to take good care of them. So, and also I think doing, since we use our care boards that have our names, that we update those at that time.
The ones that are in the patient's rooms?
Yeah.
Oh, that's a good point. That'd be nice to update that right at the beginning of the shifts.
No, they don't, yeah, they don't have to remember to do it later.
Right, absolutely. And then we can get a little bit of standardization housewide.
Yeah, I like actually use our care board.
Yeah, Chelsea boards with one stone right there.
I love it. Well,
Oh, I'm sorry.
I can't think of anything else to put on there, but I wonder if we just standardly expect to say, tell our patients thank you for their time.
Yeah. Oh, thank the patient at the end of
Yeah.
their.
Thank them, and then let them know that we're gonna come back. Let them know we have to get report on 3 other patients, and we'll be back in an hour, just to give them an idea of what to expect. I think that will help to decrease their anxiety, and they won't be on the call quite as much as if we let them know when we're gonna come back.
Gosh, you guys, that's a great list of ideas to have on this standardized report process. How do you think having this standardized is going to help improve our community and our patient experience?
Well, this seems like it's all about communication and educating our patients and involving them in their health care. I think we all, we used to just tell our patients what to do and how they're going to do it. And now our patients expect to be included in all those decisions. And really to keep them out of the hospital, they need to know the steps. They know how to take care of themselves at home.
Yeah.
So I just think an educated patient will take care of themselves at home and it will help to reduce their readmissions. Maybe make them happier in the
Yeah.
end. So.
This is a great head start. I think we should have another meeting and kind of plan on how we're going to get this rolling and what we really need. So good job, and thank you guys.
Thank you.
Yay.